Great, everyone. Thank you again for being here. I'm Colin Rosales. I'm the Strategic Partnerships Director at OpenAQ, and I'm the facilitator of the OpenAQ Community Ambassador Program, which is a 10-month global leadership program targeted to air quality advocates in low and middle income countries who are committed to utilizing open data to spur clean air action in their communities. So, you're here today in the final presentation and graduation of our 2024 cohort. Just a little background, the ambassador program started in 2021 with 5 ambassadors. And then our second cohort was in 2023, where we doubled the ambassadors to 10. And then today, here we are with our third cohort. And
О, тут
um,
третий показывает. Это четвертый сейчас. Вот это они вы заканчиваете.
Okay, so here we are with our 10 ambassadors who will be sharing their presentation today. And then also, actually, we have a lot of our previous ambassadors on the call today. So thank you for joining us. And I want to highlight some of the activities that some of our previous ambassadors have been up to after graduating from our program. For example, Farah Kazi from India is now project manager at the Epic Air Quality Fund at the University of Chicago. Rebecca Monroy Torres from Mexico published a journal article based on her community ambassador final project, where she used Atmotube to study Guanajuato, which is a rural community reliant on the artisanal brick, industry. Alexandru Lukian from Romania started a collaboration with his local university's advanced mobile laboratory to co-locate 6 different brands of air sensors, basically running his own AQ spec. Ikram Mamadov from Tajikistan is continuing to work on the Air Quality Central Asia platform, increasing air quality data access for Central Asia. And many of our ambassadors have been featured in EPIC's air quality newsletters as well as air quality actors. And some of them have also been awarded or are currently participating in air quality grants. For example, Abid Omar, who leads Pakistan Air Quality Initiative. So a lot of them are present here today. So thank you for joining. Okay, so as we speak, we are also, we are also selecting the next cohort of our ambassadors. So yes, thank you to our supporters who keep this program going. And one, our general funders to continue to support a vision of a world where everyone breathes healthy air enabled by universal access to data. Many of the representatives of these organizations are also here today. So thank you so much for taking the time. Again, I know that for many of you, it's earlier or later than your usual workday. So I really, really do appreciate you being here. I also want to thank, of course, the sponsors of the OpenAQ Community Ambassador Program, Cleaner Fund, Airgrade, and Atmo, who have provided a lot of support to our ambassadors. So here are just some photos of how our current ambassadors have deployed the sensors out in the field and also put their countries, put their countries on the OpenAQ map. Thank you again for your continued support. And then to keep us feeling inspired, I would also like to share some of the feedback that we've received throughout the years for this program. For example, so the ambassadors have found confidence and inspiration. They say that every session left them inspired and motivated, and they feel the inspiration to do everything right after each class. They also find the encouragement and confidence to deploy air sensors while wearing the OpenAQ Community Ambassador figurative badge. And they also feel a good connection with their co-ambassadors and found the sessions valuable. So please know that your support is really affecting positively all of our ambassadors now and in past. I would also like to thank all of the lecturers and OpenAQ friends that are here today. Thank you for making the time to come here and view the presentations of our ambassadors. So today is actually exactly 10 months after the ambassador's first orientation. And I'm very excited for all of us to witness the culmination of their work in the past 10 months. All of them are very ambitious in their final projects. And even if they have faced hiccups along the way, they have persevered and delivered excellently. So all of them came brimming with ideas, which at times I have to sort of tamper down because we only have 10 months and limited funding. So if you're interested in collaborating or helping them continue their work, please do reach out to them. If you see a project that you are interested in collaborating with or funding, let them know. Okay, so today what we will see are 6-minute flash presentations of our 10 ambassadors, and 6 minutes is probably not enough. So today is actually just a summary of the 15-page reports, 15 or so page reports that they've written. And again, if you're interested in collaborating with them, please reach out. Okay, so without further ado, we will begin with Maiha, who is a senior air quality management officer at the Ministry of Climate Change, Environment, and Energy from the Maldives. Take it away, Maiha.
Thank you, Colleen, and thanks everyone for your time. My research focuses on Male, the capital city of Maldives, where it's hot and humid all year round. In this kind of climate, heat stress is already a concern, but in a city like Male, where traffic congestion is high, land is limited, buildings are packed, the combination of heat and air pollution could be making conditions even worse. Moreover, we also experience episodes of transboundary haze. During these haze events, pollution spikes, visibility drops, and breathing can become difficult for vulnerable groups. So we know that both air pollution and heat stress are harmful on their own, but how do they link in the Maldives itself? But there are no local studies done. So to address this, my research explores two questions. How does PM 2.5 vary between day and night? What factors contribute? And does increased PM 2.5 amplify heat risk, particularly during haze? Next slide. So I set up the Air Gradient Center at a central location in the city and collected data for 4 months. This time frame included 2 months pre-haze and 2 months during haze. Before haze, pollution levels followed a clear pattern, higher concentrations during the day, lower at night. During off-peak hours, pollution levels often dropped below the WHO air quality guideline. However, during haze, this pattern changed. There were times when pollution was just as high or even higher at night than during the day. This suggested that haze introduced a more stable background level of pollution, perhaps, or reduced the usual day-to-night variability. So to assess whether pollution amplifies heat stress, I examined the relationship between PM 2.5 temperature and humidity using scatter plots. The analysis found weak correlations between PM 2.5 concentrations in both humidity and temperature, as shown by the low R-squared values during both haze and pre-haze. For example, during haze, the R-squared value between PM 2.5 and humidity was 0.08, suggesting that the humidity explained only 8.9% of PM 2.5 variability. So likewise, the results implied that other factors such as external pollution sources likely played a larger role in air quality changes in Male. Despite some statistically significant relationships with the low p-values, their practical impact on PM 2.5 levels seemed negligible. But interestingly, the heat index itself, which is a measure of perceived heat based on temperature and humidity, it did not show any major shifts due to PM 2.5. So this suggested that while pollution may influence temperature and humidity to some degree, its impact was, at least during this study, too small to significantly alter heat stress levels in Male. So instead, natural weather factors such as daytime temperature peaks and nighttime humidity increases seem to have a much stronger effect on heat stress than pollution. Next slide, please. So this study made one thing clear. that local pollution controls alone won't be enough to tackle air quality issues in the Maldives. Even if stricter vehicle emission rules were enforced, they won't stop pollution from drifting in. So this means that solving the problem requires more than just local action. It calls for stronger regional cooperation. But that being said, the study also highlights opportunities for targeted action because before Haze arrived, PM 2.5 levels followed a clear day to night pattern. This suggested that if we regulated traffic flow or if we restricted high emitting vehicles, this could significantly improve air quality on regular days. So, does air pollution make heat worse in the Maldives? A key finding of this study was that PM 2.5 levels potentially had little or no impact on Mali's heat index. Instead, temperature and humidity were probably the main factors driving how hot it felt. So, in order to make Mali more livable in extreme heat, the focus should be perhaps on urban planning solutions like green spaces and designing heat resilient infrastructure. So, why does this matter for public health and economy? So, while we know the health risks of PM 2.5, beyond health, the study also highlights the economic consequences of poor air quality. For a country which is heavily dependent on tourism, haze can be more than just a health concern. It can disrupt air travel by seaplanes, reduce visibility at sea for vessels, and make outdoor attractions less appealing. So, this underscores the importance of actually integrating air quality management into national resilience planning as well, and not just as an environmental issue, but also as public health and economic priority. So, the bigger picture is that our air quality issues aren't just a local problem, they are part of a larger global regional challenge. The haze affecting the city doesn't originate here, but its impact is felt here deeply. It reinforces the fact that air pollution doesn't respect borders, making international agreements and better air quality monitoring systems very critical. So, thank you, OpenAQ, our partners and friends, without whose support and lessons and guidance, this would not have been possible. Yeah.
Thank
So
you.
for us, it's an opportunity to push for stronger global action on air pollution for Maldives. Thank you. Thank you all.
Thank you, Maiha, and thank you so much for sharing your insights about heat index and air pollution and how all of the factors play into it or not play into it. Also, thank you for putting Maldives on the Open AQ air quality map. Our next ambassador will move on. Is Antonio Mozambique? Antonio Banze from Maputo, Mozambique. Antonio is the leader of a youth organization called Stark Green Generation. Antonio, take it away.
Hey, Colin, and hi, everyone. Yes, my name is António from Mozambique, and I'm really advocating for air pollution in Mozambique, and we're really trying to bring youth together to fight this issue. So next, Colin. Yes, basically, Mozambique has so many sources of air pollution, and we can see we have vehicle emissions, we have industries emissions, and we also have coal burning. And this last is the major issue in the households. That's why indoor air pollution is the huge risk for our population here than outdoor, because the way we use cooking to cook. So this project basically is to bring this consciousness to our community, because we've seen that we have been discussing so many climate issues or environmental issues, but when it comes to air pollution, we don't see so much advocacy. And also we see so many lack of access to data. So this is also part of the project, not only advocate for air pollution, but also create a platform that is going to bring data together so that the community can have access to it, as well for either for research or also for policy making. Next, please. So yes, to make this to reality, we have used these methodologies. We have brought community engagement through talks that we've been doing with community leaders, and also we've been doing talks in schools in different levels of education, and also we have been training air quality monitoring. This started recently through the help of OpenAQ that has helped us with sensors, what I'm talking about, Atmo2 and air gradient. And it's actually our first experience having sensors in our organization. So it's very challenging, also very inspiring. So another methodology that we're using is through advocacy campaigns and awareness, through not only in Maputo, but in other provinces. The last methodology that we're still developing, I would like to have brought this platform or it online, but we did everything on our possibilities and we didn't manage to bring it. But currently in our organization, we're developing this platform called SDG Explore platform. We got this inspiration from OpenAQ platform that we can have access to data. So we are developing this platform where we're going to bring all data to all air pollution data to access to everyone. So anyone can have access to this data, because currently in Mozambique, there is no platform where you can go and find air pollution data. You can find through some systems that we have from NASA that they've installed some sensors, but it's not enough. And we really need to find our whole country covered. So having just these two sensors, Atmo2 and air gradient, is really helpful, because it's also helping us to train our data and also helping us to make it possible with small beginnings. So the results and successes that we've found through this journey, we have managed to bring so many people together, not only for our organization, but also people interested in air pollution issues. We have been reached with some also youth organizations that they want to help us with it. We have managed to bring so many partnerships, not only national partnership, but also international, just to mention some. With the first one, OpenAQ, of course, and also we have Youth Climate Justice Fund as our partner. We also have social movement coaching that they coach leaders to have more effectiveness in their work. So this partnership also helped us increase our chances to have this project successful. Next, please, Colin. Yeah, so as a conclusion, we have seen that this project is really important, not only to have access to data, but also to use this data to empower communities. So that's why we really focus on schools, because we really want to train our students, our national students, about the air pollution, the impacts of it. And the next steps that we are really foreseeing right now is to complete this platform that we're going to bring data together. So hopefully we're going to share it through OpenAQ channels. You will be able to see it in the next months, we hope. And also, we really want to expand our partnerships, focus on more sustainability, and advocate for all changes. So hopefully we'll have more people interested from this presentation to help us make this possible. Thank you everyone for your attention and your time.
Thank you so much, Antonio. Thank you so much for sharing about your efforts in Mozambique, engaging the youth, and I'm looking forward to the SDG Explorer. Our next presentation is Kostadin. Actually, Kostadin is now a double doctor. Kostadin is not only a physician, but he also just finished his doctorate from the Medical University in Plovdiv. Kostadin, take it away.
Hello, everybody. My name is Kostadin Kostadinov, and I'm assistant professor from the Medical University of Plovdiv. I hope you can hear me. In today's 6 minutes, I'll show you two cases from Bulgaria showing that air pollution, even in some countries in Europe, is still a problem, and we have to show the data in order to commit for real political change. Next slide, please. So, despite the effort and despite the legislation established within the European Union and also in Bulgaria, we have several problems with air pollution, specifically in winter seasons. However, in summer, we face every year a source that haven't been so frequently faced before, and this is when we have case of fires, and unfortunately, this is happening every summer now. So the first case study in my presentation today will be about that, a fire in the waste plant in Plovdiv, which caused a serious impact with terrible air pollution in the region for several days. And I will show you the data about how this affects immediate hospitalization and emergency hospital visits in a local hospital, which was located under 1 mile from the Atmo-tube deployment spot. And the second study in this presentation will be about the behavior change, the attitudes of people in another region in Bulgaria, Rosales, which is known to be, again, highly polluted, not only because of the local sources, but also because of the trans-country pollutions. Next slide, please. So what I did, because of the knowledge and skills acquired in that program, and also the means, that Atmo-tube that I was provided, is to record the data and I was able to capture this significant event on August the 2nd. You can see the peak in the particular matter 2.5, and it was really significant. It was outstanding. But what was more interesting is that in this local hospital, not only the amount of emergency visit was high, but also the proportion of hospitalization within this emergency visit was also significantly high. And not only immediately after the pollution event, but also 2 days after we had another peak that also proved to be statistically significant. The second study employs online survey with 15 questions, and it was distributed by social media, and the data was collected and analyzed, not only by me, but also with my colleagues. We work together in the air doctors network for clean air in Bulgaria. What we observed in that survey was that people are actually really anxious about the air quality in their city. And that was the trend for more than 20 years now, with no significant political measures done within that time frame. Mostly people with chronic diseases. Unfortunately, they're not very, they don't have equipment or knowledge to help themselves in that situations, because most of them reported that they don't know what specific measures can they do in case of severe air pollution. Most of them reported that they avoid going out on pollutant days, or they use the home air purifiers. However, most of them are not aware of specifically what are the health effects. And unfortunately, some of them reported that they even want to leave the town because of the problem with air pollution. Next slide, please. So little is known about the immediate health effects of air pollution, and our study shows that those frequently seen air pollution events, such as fires, can result in increased number of hospitalization and therefore increased hospital utilization resources. And this can not only impact the people who have symptoms of respiratory diseases, but also affects the healthcare system as a whole. And our work also showed that people are aware, but unfortunately not well equipped with knowledge and skills to tackle this problem in the region of Hossain. The equipment we have now and the knowledge and the skills that I acquired during that program will help me to continue my work, this scientific work on air pollution and specifically the health effects on it. Next slide, I think. Yes, hopefully the new thing is that I'm now equipped with this air gradient and I can record the daily data again. But not only that, we continue our cooperation with the local hospital, and they give us again the number of hospitalizations for longer periods of time. So by the end of this year, 2025, we will be able to provide more comprehensive data about 1 year period and to show the trends of air pollution and hospitalization within the city of Plovdiv. Thank you for your attention, and let's hear the other presentations.
Thank you, Kostadin. Thank you for giving us the perspective from a medical and healthcare system of the air pollution effects in Bulgaria, and looking forward to the continuing analysis. So we'll move on. Our next ambassador is Rafa. Rafa is from Florianópolis, Brazil, and is the CEO and co-founder of Iris, an air sensor company. Take it away, Rafa.
Thank you, Colin. Good afternoon, everyone. I am Rafaela Borth. I'm from Florianópolis, south of Brazil, and I'm going to present you a little bit about my final project, which is named Advancing Low-Cost Sensors Network in Florianópolis, Data Integration, Calibration, and its Applications. Next, please. So to introduce myself a little bit, I'm an environmental engineer, and I'm also a master's student at the Federal University of Santa Catarina, and I'm working with air pollution since 2019. And in 2022, I co-founded Iris, which is a startup that develops low-cost air quality monitoring systems here in Brazil, because we didn't have a national technology for that. So to help you get familiar with our problem that motivated my work, even though Brazil has a total area of 8.69 million square kilometers, only 0.22% of this area is covered by reference monitoring stations. And this means that only 25% of the Brazilian population has access to this technology and safety. And that's mostly due to the high cost of installation, operation, and maintenance of these stations. So, please next, Colin. With the support of the program and using the low-cost sensors we developed at Iris, my final project had two main goals. The first one was to create and apply a calibration protocol for Iris sensors, comparing the results with air gradient, atmotube, and the new reference stations we have now in the university. And the second goal was to develop a protocol for integrating external databases into Iris air quality monitoring platform to the data to be accessed by our population. So for the key achievements, we could deploy the calibration framework and compare data sets. So we could compare atmotube, air gradient data, and reference station data for 3 months data, basically. It was not possible to compare Iris data because some electronic malfunctions in our sensor board, which gave us just historical data to finish and first test the calibration protocol. So we need to improve this further. And we could evaluate the performance of the sensors by doing that. We could also, with air gradient and atmotube data, capture wildfire pollution using local sensors here in Brazil, even without the reference station that we didn't have that time. And we highlighted high PM2.5 levels, exceeding WHO standards in 3 to 4 times in September 2024, because we face a very critical situation with wildfires in Cerrado biome in these months here in Brazil, even though the fires happened 2,000 kilometers away from where the sensors were locations. So it was very critical moment for us. And Well, we also could do the data integration successfully. So we develop an ATL pipeline to sync external datasets in our platform, and we integrated Atmotube and air gradient data into Iris platform. And we also built a data import tool for flexible datasets ingestion when we talk about historical data, for example. So next, please, Colin. Here you have some takeaways. Well, the calibration protocol reached 45% of accuracy, so we need to test with more data. We had some challenges, as I said, because of electronic malfunctions, and we are already fixing it with new versions of our low-cost sensors. And by successes, we built data integration pipeline, which was really, really cool, and successfully processed air gradient and Atmotube data into ours. So what's next for us at Iris in the lab? We're going to expand the deployment and test more Iris low-cost sensors. And finally, we're going to analyze and compare the results from Atmotube, air gradient reference stations, and Iris stations. So now we have a lot of data to do this comparison. And we want to bring more sensors to our platform to test the integration protocol. And finally, I have some points for collaboration and contribution. Maybe I can help you, or you can help me with my project. And maybe with calibration or data visualization, by providing expertise and feedback on our calibration protocol, for example, with integration and standardization, by working together to align more about ELSIS with global air quality standards. So Brazil need to be on track on that discussion. With technology and hardware deployment, sharing some insights on sensor durability, data transmission, reliability. That's mainly my master's topic. So it's really nice if you can share some insights here. And finally, with open data and research collaboration. So we're very open at Iris and at the lab to co-develop studies, exchange data sets, some ideas here, and drive more innovation in this field, especially here in Brazil. That's very in its beginning. So that's it. Thank you very much. And let's see another presentation.
Thanks, Hafa. Thank you for sharing about your efforts in increasing air quality monitoring and integrating all of this in one platform. And we look forward to the next steps. We'll move on. Our next presenter is Rakib. Rakib is a public health researcher from Dhaka, Bangladesh. Rakib, take it away.
Hello everyone, this is Rakib Hossain from Dhaka, Bangladesh. So the research project I have worked on is titled as Personal Air Pollution Exposure and Respiratory Health Outcomes among smoking and non-smoking residential students at a university in Bangladesh. Next slide, please. So before going to the main discussion, I'd like to give you a brief backdrop to understand the impact or importance of this study. Air pollution, particularly fine particulate matter pollution, is a critical public health issue in Bangladesh. In the capital, Dhaka, the annual PM2.5 concentration is around 12 to 16 times the WHO guideline, and air pollution here is very localized with major sources. Personal habits such as smoking also increases individual PM2.5 exposure, which compounds health risks, particularly for lung health. And university students are especially vulnerable as they are frequently exposed to multiple pollution sources, both indoors and outdoors. Many also smoke, creating a dual burden for air pollution and tobacco exposure. Despite a high smoking prevalence among students, there is a lack of localized data for comparing personal air pollution exposure between smokers and non-smokers. So given this context, we designed this study. Next slide, please. So in the methodology, first the study area, we have chosen Jahangirnagar University, which is a completely residential university, situating in the outskirts of Dhaka, and you can see the location of the university on OpenEQ map. And this was a cross-sectional observational study. We included 8 participants, of them 4 were smokers and 4 were non-smokers, and we monitored them over a 2 days period. And for personal PM 2.5 exposure measurement, we utilized Atmotube Pro monitor, and we also installed air gradient outdoor monitor as background stationary monitor. And for understanding the impact of different activities on individual pollution exposure budget, each participant maintained a daily logs of activities. The information on the activity log were then cross-referenced with their respective PM 2.5 data for further analysis. And for respiratory health assessment, we conducted spirometry test, and FEV1 FVC ratio were taken as core metrics for respiratory health assessment. In the results section, in figure A, we fitted a linear regression model between ambient hourly PM 2.5 concentration and personal level hourly mean PM 2.5 concentration. The positive slope of the regression of the model shows that as the personal level PM 2.5 mean PM 2.5 concentration increases, as proportionally increases with the increment of ambient hourly mean PM 2.5 concentration. And in figure B, you can see there is 2 column. The figure B actually about relative daily exposure of PM 2.5 exposure for each observed activities, and you can see there is 2 column. One is duration and another is mean PM 2.5 concentration. So if you can closely observe in the light gray marked area, student who smoked only spent 10% of the time in smoking, but this contributed around over 25% of their daily mean PM 2.5 concentration. So smoking is a key factor in personal level exposure, PM 2.5 exposure. And in the figure C, we find that a person who did not smoke has better respiratory health outcome compared to the person who smoked. But this difference is not significant, which is maybe due to small participant size, small sample size. And beside the results, we also successfully involved over 30 students in our project. We took sessions with them, make them aware about air pollution, how they can protect themselves from air pollution, and make them environmentally concerned. So this is one of the success that I want to mark here. Next slide, please. And so the conclusion, student faced extreme air pollution, non-smoker should better lung health, and smoking can amplify the adverse effect of air pollution. So as a recommendation, I'd like to recommend that pollution mitigation should be conducted, should be done in the university campus, like banning of open burning and enforcement of dust control rules. Students should be aware. Health monitoring should be conducted within the study area, within the campus, and dormitories should be upgraded, like installation of air filtration system and improve of ventilation. So overall, I want to call for collaboration to upgrade and upscale this study in different across different universities in Bangladesh, and to strengthen the evidence on air pollution and smoking interactions. So thank you all for your patience and being here. Thank you, Colleen, and everyone. That's all from my side.
Thank you, Rakib, and thank you for giving us the public health perspective of PM 2.5 exposure for this very select population of smoking/non-smoking university students in Dhaka. We'll move on. Our next presenter is Ravkat. Ravkat is an environmental economist, human rights activist, and project manager at Almaty Air Initiative. Take it away, Ravkat.
Thank you, Colin. According to the State of Global Air recent report, air pollution was responsible for over 63,000 premature deaths in Central Asia in 2021. And despite being one of the world's emerging air pollution hotspots, there are knowledge gaps in understanding the details of the burden of air pollution in the region. Our project aimed to fill some of those gaps. Next slide, please. As Colin said, I'm Ravkat. I'm an environmental economist. For the past 10 years, I worked in environmental econ research, studying costs of water pollution, business consulting, conducted air pollution research in an analytical chemistry lab, and now I lead projects at the Almaty Air Initiative, a private fund dedicated to fighting air pollution in Almaty, and hopefully eventually beyond. Today, I'll walk you through my project, data-driven study on air pollution's short-term health impacts and why this research matters for both public policy and public awareness. Why this project? Public health effects of air pollution are understudied, and there are several factors affecting this. There's limited region-specific data, inconsistency in research methodologies, lack of reliable air pollution data, lack of public health research focusing on air pollution data, and hence there is little local data-driven public health-related evidence in air pollution discussions. This affects the effectiveness of public policy interventions, and the public lacks clear guidance on protecting themselves. My project addresses this gap by analyzing the link between air pollution and hospital admissions, while also exploring innovative ways to engage the public. And also I had the 2021 and 2022 hospitalizations data on my hands since early 2023, and I couldn't find time to spend my effort on this project. And I'd like to thank OpenIQ for providing me with this opportunity to push my research forward. Next slide, please. Yeah, my final project consists of two key components. First is public engagement component supported by the OpenIQ Ambassadors Program and its partners. And second, health impact analysis to quantify air pollution's effect on hospitalizations or hospital admissions. For the public engagement, we distributed AtmoTube air quality monitors to runners, bloggers, and courier to measure real-time exposure. And some of the projects are still running. We conducted an air pollution study with a courier tracking their exposure across the city. And also I put my neighborhood on the OpenIQ map. Additionally, I personally tested the air gradient monitor, exposing it to extreme conditions, including emissions from a dirty vehicle's exhaust, just to test the sensor's responsiveness and whether we want to buy more of the air gradients in the future. And as for the health impact analysis, I analyzed daily hospital admissions records across 5 key diagnosis groups, which are respiratory, cardiovascular, mental health, pregnancy-related, and perinatal conditions. I compared these with PM2.5 pollution levels collected from local monitoring stations across Almaty. And I developed a dose response model and ran regression analysis to assess pollution's impact on hospitalizations. Runners, bloggers actively participated and engaged with the data they got from the AtmoTube. I believe this increased public awareness, although engagement declined over time. And the courier study showed alarming exposure levels, an average of 90 microgram per cubic meter per 10 days, with peaks reaching 300 to 400, sometimes even 500 micrograms per cubic meter. And over 57% of the time, the participant was exposed to unhealthy or hazardous air quality levels. And I was able to publish the results in local media. As for health impact results, I still consider these results as preliminary, and I believe that they can improve robustness of results and validate the model in coming months. However, so far, no significant link was found between air pollution and hospitalizations for 4 out of 5 groups. For cardiovascular, respiratory, mental health, and pregnancy-related conditions. However, perinatal hospitalization showed a modest but significant association. 10 microgram per cubic meter increase in PM2.5 correlated with 0.4 additional hospitalizations per day. I believe data limitations reduce the model's explanatory power, which highlights the need for more granular, detailed data. Next slide, please. This study suggests that air pollution increases perinatal hospital admissions, meaning pollution may have serious consequences for the newborns. However, and maybe additionally, throughout the program, I understood that research alone is not enough, and we need to, what is also important is how we communicate the results, and I will work on this, communicating the results of this research in the future. The general public and media don't read scientific papers, so researchers must work with journalists and communication specialists to make findings accessible. And at the same time, scientific methods can enhance media reporting, bringing credibility and depth to air pollution discussions. And these are the insights I got from my work with courier and data of analyzing the exposure of courier to air pollution. And for the future, there's a lot more to uncover. Moving forward, we need more localized health studies on air pollution in Central Asia, better data access for from public health institutions, more detailed datasets including patient-level records, spatial pollution data, and socioeconomic indicators to improve model accuracy. And I believe my research would hugely benefit from engagement with public health experts to refine health impact models, and with econometricians and statisticians to enhance data analysis methods. I think that's it for me.
Thanks,
Thank you, Colleen.
Ravkat. Thank you for sharing also how you engage different communities and also giving us ideas which communities to tap when it comes to public engagement. And thank you for also the health related insights. I like the air pollution stripes. Thank you for showing that. I'll move on. Our next presenter is Safiya. Safiya is a thoracic physician based in Trinidad and Tobago. Go ahead, Safiya.
So hi everyone, my name is Safiya Cummings and I'm from Trinidad and Tobago, and it's a pleasure to be at this graduation ceremony. So my Open AQ project actually started with a question, which is how can we increase awareness and advocacy for air quality, starting with our most vulnerable population groups? Next slide, please. As a physician and an advocate for public health and the built environment, I've seen firsthand the impact of air pollution on respiratory health. So from increased asthma cases in children to the burden of chronic lung diseases, the air we breathe is actually shaping the health outcome of our entire generations. Yet, air quality remains an often overlooked part of the conversation in public health. For children are highly vulnerable to health impacts of poor air quality, yet schools, where they spend most of their times, actually lack the awareness, tools, and resources to monitor and advocate for healthier environments for children. In Trinidad and Tobago, what we're exposed to as the key contributors of air pollution is generally industrial pollutants, vehicular emissions, and Sahara dust surges. What we found is that many schools are actually located in high traffic zones, and therefore they're actually more predisposed to the effects of traffic-related air pollution. As such, owing to the vulnerability of children, we identified a need for the integration of air quality awareness into training modules for teachers to try to advocate for better policies for their students and improved health outcomes. Next slide, please. So to address this gap, I focused on developing an air quality toolkit for schools in Port of Spain, Trinidad and Tobago. And this resource was designed to educate teachers about air pollution, its health effects, and most importantly, how they can advocate for cleaner air. The approach was kind of designed with 3 factors in mind: to build awareness, for educational engagement, and community advocacy. This initiative was brought to life through partnerships and presentations, as well as knowledge sharing sessions. So one of the key milestones was actually presenting to Sacred Heart Girls RC School to over 100 parents and teachers. And the response was actually overwhelming. Parents shared their concerns, and teachers saw the need for continued education. And some of the students who were present were eager to learn more. As such, we were invited back to their upcoming Climate Change and Science Day, where we'd actually host like a workshop teaching them more about the use of air quality monitors and how they can navigate changing their environment for better health outcomes. We also distributed copies of the Air Quality Toolkit during this event and at other events that we were invited to, and this stimulated more conversations on the theme. As such, I have been invited to different platforms outside of the school arena. So therefore, I had the opportunity to participate in a pathway-led training for city leaders on air quality monitoring to strengthen knowledge and align our project with broader regional efforts. I've also been invited to discuss the impact of air quality on occupational hazards for one of the regional health authorities. And then I was able to educate physicians on the utilization of our personal air quality monitors as well as low-cost sensors to promote open data sharing to actually promote greater scientific projects as well as greater communications between physicians and their patients. So next slide, please. In terms of our challenges, no project was without a challenge. So one of the biggest hurdles was actually navigating policy engagement, because as we reached out to organizations, it was difficult for them to change their plans that they had already set in motion for the year. So hence the invitation to what they've already set in motion to kind of air light on how we can improve the air quality landscape in Trinidad and Tobago. But one of the questions that arose was, while many stakeholders recognize air quality as an issue, how can we translate awareness into action? And this led straight back to improving advocacy efforts. Another challenge was to ensure sustainability and make sure that our efforts continue beyond a single presentation and a workshop. And therefore, we are advocating for further collaboration, ideally with the Ministry of Education, to continue our project aims. So as we step into 2025, we aim to strengthen collaborations, scale up localized air quality monitoring by promoting schools to invest in air quality monitors to improve our landscape and reach throughout our country, and to develop more educational tools, as many have actually called for a storybook on air quality to bring this taught more to children, which I am actually in the preliminary stages of developing. So to close, I'd like to emphasize that air quality is not just an environmental issue, but it's a human rights issue, and clean air should not be a privilege, but a standard for all. And I'm deeply grateful to OpenAQ and all of its supporters who have supported this initiative thus far. Thank you.
Thank you, Safiya, and thank you for sharing your outreach activities and also all the challenges that came with it. May I also add that in addition to being this cohort being a cohort of community ambassadors, we are also certified carbon literate thanks to Safiya's training that she gave to us. So I really appreciate the emerging themes also that connect many of our ambassadors' work. I'm sure by now you've heard, many of the connecting themes, and everyone has learned from everyone's experiences. So we'll move on. This is example of Safia's work. We'll move on to Sapana. Sapana is a middle school teacher based in Kathmandu, Nepal. Sapana, take it away.
Thank you. I'm Sapana Bhazel from Kathmandu, and for the final project of OpenAQ Community Ambassador Program, I have done a few things. Next slide, please. Talking about me, I have done my master's in environmental science, and I have also been working in air quality since my thesis days. So, as you can see from the picture, there is our Kathmandu Valley underneath the haze that you can see of the air pollutants. So, people are used to seeing air pollution around them in the city, but most of them are not aware about the causes, sources, impacts, and mitigation measures. So, there is a need for increased awareness, and knowing about PM 2.5 concentration through the data could give an idea about the potential impact that could happen as well. That's why I have tried to focus on these things through the project. Next slide, please. And the first thing we did was a presentation-based awareness building campaign among the students, titled Air Pollution Awareness Campaign, enlightening the school children. And the next thing along with that we did was a survey on perceptions of air quality of school teachers, where a Google form was circulated among the teachers. Within the sensor deployment, air gradient sensor was deployed uh, at the entrance gate of Ideal Model School, Lalitpur district, and Atmosphere Pro was used to assess the public bus drivers exposure who drive their buses in long route through Prithvi Highway. And both the devices were co-located with the reference grade monitor at International Center for Integrated Mountain Development, ICIMOD, Kumaltar, Nepal. And OpenAQ Explorer was used to retrieve the data from air gradient, whereas we retrieved Atmosphere data from Atmosphere app itself. And Visual Studio Code and MS Excel were used for visualization as well as data analysis. For the correction of the data after the collocation, linear regression was used, and we utilized the equation that we received after the linear regression to correct the data as well. Talking about the results and successes we have had, approximately 700 students, we were able to outreach approximately 700 students across 4 different schools, and we were able to make them aware about indoor and outdoor air pollution, their causes, impacts on their health and environment as well, possible mitigation measures, and how we can protect ourselves. Among the 25 responses we received through the Google Forms, majority of the respondents thought that traffic emissions was the primary cause of air pollution in the city, followed by industries and construction dust as well. The teachers themselves faced issues like fatigue, headache, irritation, coughing, allergies, and other respiratory problems. They also talked about how they were not able to go to morning walks and how their clothes and houses got dirtier quicker due to air pollution. Among the students as well, 56% of the teachers observed allergy cases, and 24% of the teachers observed fatigue and decreased concentration. 24% observed increased absenteeism due to different respiratory issues, and 24% observed no noticeable impact at all. From the plots that you see on the right-hand side, this is the data from air gradient sensor that was deployed at the school, and the most of the data during the 1 week period we took the data in December month showed that majority of the data was well above the standard set by WHO and Nepal's guideline as well. And especially during the rush hours in the morning and evening, we can see the data picking up, which means that the vehicular emission also impacted it contributed to the air pollution in that particular area. And if we look at the data taken by Atmosphere Pro, these two plots signify different buses that the sensors were deployed into. And we can see that the first bus has a higher PM2.5 concentration, whereas the second has lower. This is mainly due to the facilities available in the bus. The first one did not have air condition, and that's the reason the windows had to be kept open. So in the second bus, the windows were closed. So facilities provided in the bus also impacts it. Next slide, please. Talking about the conclusion, awareness building activities like this can have ripple effect where the students can share their knowledge they have gained with the families and their friends as well. And low-cost sensors are efficient way to assess air pollution levels in different environments of the city. So more increased use of low-cost sensors should be done in different locations to provide real-time data to the public. I plan on further extending the awareness campaign among youth as well as continuous use of sensor received here. And for that reason, I'd like to request anybody who can help us in expanding the campaign, not only within Kathmandu Valley, but there are cities close to Nepal and India border where air pollution issue is equally a serious issue over there. So I'd like to expand the campaign, awareness building campaign over to there as well. So we could collaborate on stuff like this. I'd like to thank everybody who have helped me in this project, and especially the OpenAQ team. Thank you very much. That's it for me.
Thank you, Sapana, and thank you for sharing different aspects of your outreach and awareness, also including the inevitable exposure of to indoor and occupational air pollution. And I hope you all saw the video. It was a tour of the exhibit that Sapana and her team had recently. We'll move on to Melissa. So Melissa is a communications officer from Douala, Cameroon, and she works with Elias and Clean Air Africa. Melissa, take it away. Melissa, if you are speaking, I don't think we can hear you.
Hi, everyone. Can you listen to me? Can you hear me?
Yep, we can hear you now.
Thank you. So for internet connection sake, can you allow me please to turn off my video because sometimes you have some internet issues.
Sure.
Okay, good. So my name is Melissa Kwenku and I'm a communication officer. I work for two organizations. So next slide, please. So I serve as a communication lead for Clean Air Africa, a project which advocates for the transition of household to clean energy. And I'm also an active member of the Environmental and Long-Haired Association locally in Cameroon. And my work revolves around using strategic communication to drive awareness and shift mindset on air pollution. So currently, Cameroon lacks air quality monitoring policies, and that makes air pollution to be a distant issue for the population. So in order to better raise awareness, I've decided to work on two areas. First of all, assess occupational exposure to PM 2.5 by measuring air pollution risk in specific professions such as spice grinders, and also educate students in the environmental club to make them air quality ambassadors in their community. Next slide, please. The methodology employed for those two areas, for the first one, spice grinders. So we have to know that this final project was written under the Elias Association. So in order to perform the research, we have obtained an ethical clearance to have at least 10 participants who were to wear the Atmo tube for at least 24 hours to measure the exposure to PM 2.5 during their activities and even indoor. And for the air gradient, initially we were to deploy the installation in a school because the idea was to empower the students to assess the quality of air they were breathing and to empower them in how to collect the data too. But that procedure was really long and it was a long process. And while waiting for the authorization to be delivered, since the beginning of the academic year, we have empowered them in raising awareness around air pollution. And we did a kind of game at the end of the year in the month of December. We suggested them to go during their break, during their holiday, to identify sources of air pollution and to come back with solution. And we did a presentation in the month of January, and it was really incredible. So coming back to the spice grinders, at the level of the result, we have assessed them, and in order to present the results, we wanted to have a kind of different way of displaying it. We know PM 2.5, we know how damageable these are, but for them to be able to better understand the impact on their health, we have converted the average exposure of PM 2.5 in 24 hours in the cigarette equivalent. So under the result part, you can see that some participants are smoking, let me put it in quotes, 2 cigarettes per day. So that's to say that they're exposed to air pollution that can be compared to somebody smoking 2 cigarettes per day. And you know that this profession they are doing outdoor and there are other vendors surrounding them. So you can imagine the passive smokers, so the people exposed to the same type of pollution due to their closeness to the activity of grinding spices. So for the air gradient, finally, we have deployed it in an open environment. And you can see the data, the first month from the month of September to the month of November, it was indoor in our office because we were learning how to use the appliance. And for the month of December, it was outdoor. And the red line that you see is the recommended target for the WHO, and you can see that the value are far above. So one of the success during this field work is we got finally in the beginning of the month of June the authorization from the Ministry of Environment to install air gradient in a school, and not only in one school but in Douala, and we were so happy. You can see the photo, it's a picture of me and my colleague presenting the air gradient, and the other picture is the delegation itself, the member of the delegation itself. Next slide, please. So, that concerning the spice grinders, it was a kind of pilot study that we were doing. So out of a part of collecting collecting the PM 2.5 measure, we also did a Kobo 2 collect a questionnaire to assess their knowledge on air pollution. And the results show that 44% of people have limited knowledge on air pollution, and 78 have never encountered any awareness message on air pollution. So there is a need to tailor message for them. And for Aggregate, we plan to install it in the month of February. And for future work, Elias wants to continue assessing the exposure of occupational exposure to PM 2.5, and we want to enlarge it to other occupations such as woodworkers and even people who manufacture charcoals. And with the ethical clearance, it will be easy to do it. And with the Aggregate sensor, after installing in one school, we want to do it in each council of the town of Douala in order to have the accurate air quality breathed by the student in the town. So at the end, what I want to do personally, because I've been really empowered during these 10 months of Open AQ community ambassador training. So I really plan to launch a podcast named Voice of the Air, Decoding the Invisible with Air Quality Stories, because that field activity that I did, it was really to get the feedback of people on air pollution. I had some hints, but I really wanted to be sure that people need to be informed. So that's a great opportunity for me to, like, maybe I'll reach out to you one day, I'll DM you one day about participating in this podcast. And the whole idea is to give the voice to the community, to all the layers, like stakeholders, community, policymakers, and the layman, so that people will be more aware of what is air pollution, that silence rate, and have concrete and actionable information in order to protect themselves. So that's all for me, and I'm really grateful for this program, and thank you very much, Colin. Over.
Thank you, Melissa. And thank you for not only for spreading awareness in Douala, and thank you for sharing that very surprising number of 78%. This is a massive opportunity for your work, but also spreading awareness to us as the audience in terms of what occupations like spice grinders are really impacted by PM 2.5. Our last presenter for today is Victor from the Philippines. Victor is an all encompassing sort of air quality advocate in Iloilo City. Victor, take it away.
All right, so good day, everyone. My name is Victor. So in the Philippines, it is generally known that the main contributor to air pollution is vehicular traffic, but sometimes volcanic activity plays a role. So locally in my city, so next slide, please. Next, please. All right. So locally, in my city, this information is not clear due to the limited air quality monitoring infrastructure. As you could see, most of the monitoring infrastructure is centered in Metro Manila, the capital. And so some of the cities to the south do not have real-time air quality monitoring. And the problem lies there since temporal variations in air quality is important because sometimes due to emergency situations like volcanic activity, after some time of inhaling sulfur, you might not smell sulfur a bit more due to the increasing concentration in sulfur does not affect, right? You cannot detect it after some time. So next, please. So here in my city, in Iloilo City, we have regulatory monitoring stations. However, these are manual stations. We could only get monthly averages, and so daily concentrations could not be so easily captured. So particularly at the center of the city, we have PM 2.5 and PM 10. Unfortunately, we could not co-locate our air gradient sensor there due to the nature of the monitoring device. So I consider my final project as a community outreach. So to make air quality available to all. So that was my initial initiative. So to create local dialogue and local conversation. And thank you to Akim Haug. After meeting him, he gave us 10 air gradient sensors, and that started my journey as an OpenAQ ambassador. So next slide, please. So since this is a community engagement project, our main focus would be the installation of the air gradient sensors. And so it was physically impossible for me to maintain and monitor if all those sensors are in operation. And so my main target would be to spread the advocacy to my students. And so I gave them a task to install the sensors to their high school and high school alma mater. And so initially it was hard for us to install the sensors, but after connecting with the city government, we were so easily accepted by the local community because we have a representative from the city environment office. So I think that would be one main thing that I'd like to point out. And also after that one, it all cascades down. We connected with the environment office, and then later on, with the help of both the city environment, we worked so easily with the siting installation. So I was proud to capture volcanism event way back in November. It turns out that the PM 2.5 concentration is a bit higher compared to the PM 2.5 level concentration during the New Year's celebration. So that's an interesting finding for us. So next slide, please. Oh, this one is a screenshot of the sensor readings after the New Year's celebration. It's 12:17 a.m. and the levels are very, very high, 811 micrograms per cubic meter. But yeah, we still have to co-locate our sensor. And so let's just say it's in the hazardous levels. So next slide, please. So since there's only 5 sensors installed, we still have to work with local schools and universities to install our sensors. So next slide, please. So there's still more that needs to be done when it comes to this project. It's just halfway. So we still have to hold back our results and check for QA/QC. So there are interesting observations of PM 2.5 levels, but there's still more that needs to be done. So next steps would have been to, I'd like to point out the exploration of the characterization of PM 2.5 because we are near the sea, and so the PM 2.5 might not be pollution related, might be just sea salt. And so we still have to explore that one. And lastly, we wanted to connect with fellow advocates in the Philippines, locally, and also internationally. So since we need some sort of regulatory reference device to co-locate our sensors, since most of the PM 2.5 sensors in my region was relocated to another island due to a volcanic eruption. And so there's still more that needs to be done. Thank you very much, everyone, and have a great day.
Thank you so much, Victor. And thank you again to all the ambassadors for for sharing your great work. I know 6 minutes was not enough, and there is a lot of work that went into this. So please, I encourage everyone to connect with our ambassadors. If there is something that really captured your interest, like say, for example, you want to dive more into the natural sources of PM, just like Victor mentioned, or communication efforts, or if you want to participate in the podcast that Melissa mentioned, please do reach out to our ambassadors. For now, I would like to turn it over to our Executive Director, Chris Hager-Bomber, for some closing remarks.
Hi, everybody. This was so inspiring. So, on behalf of OpenAQ, including our board of directors, I want to extend a huge congratulations to every one of you. You really put your heart and soul into expanding your air quality skills. You developed and executed unique and valuable projects across all sorts of aspects of air quality. You supported each other on your journey. And honestly, we at OpenAQ were so honored to have had that opportunity to work with you. We consider you to be family. We're really inspired again about what you've done so far, and we know you're going to continue to make a difference for the health and well-being of your communities and beyond. So with that, I formally announce you as graduates of the OpenAQ Community Ambassador Program.